Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins us again this week. Hey, Chris.
Morning, ma'am.
Let's talk about the numbers. We're seeing them starting to trend down, not just here in the state, but nationally as well.
Yep, that's true. We are seeing a decline in the number of cases statewide and locally as well. Hopefully that means the Delta wave is over here and just in time to hopefully give the hospitals and healthcare systems some relief as we move into the holiday season.
Does that mean we're in the clear?
No, we're not in the clear. Sorry. Delta obviously was highly infectious. I believe Lambda was the next one. It doesn't sound like that's as bad. Mu is kind of panning out to be not as bad, but we're certainly a long way to go. But I think the evidence here is that the vaccinations are helping keep this from being a lot worse than it could have been.
That's right, because we see these mutations because people are not getting vaccinated, correct?
Well, we may be seeing the mutations regardless, but those that are unvaccinated are certainly providing plenty of kindling for the fire and giving the virus much more room and more leeway to incubate, mutate, find better ways to spread, and make itself more contagious as well.
And we're talking about vaccinations. You guys are going to reopen your clinic over at the 4-H Fairgrounds tomorrow. Tell us what we need to know about that.
That's right. We are opening back up the fairgrounds. It'll look much more like when we ended and moved back out of there than it did when we started. We kind of started out really big and kind of tapered off as interest waned. Right now, we are going to start out with about 5 stations as we get going. But we wanted to move back in in anticipation of Moderna being authorized for booster vaccines. That way we have more room to help safeguard folks, make sure that they're getting the right vaccine and things like that. But we will be doing first, second, and booster vaccines out there all at the same time.
How do I get an appointment? Do I need an appointment?
You do need an appointment. An appointment's preferred, I should say. You can walk in, but an appointment is preferred. If you're getting your first or second dose, there's really nothing special you need to do. The big thing to stress is for those booster doses. Right now, it's 65 and older, or I believe it's 18 and up. With the 18 and up that have an occupational reason, live in a congregate setting, or have underlying health conditions. They're eligible for boosters. The other big thing is you have to be at least 6 months removed from your second vaccine. So right now we're looking at, what is that, February, middle of February, essentially.
Great.
And sooner or previous to that.
How's testing coming along? I know you guys have got testing back up and running at the health department.
Yep, testing's up and running. We are still adding a couple more people to help flesh out our hours. We anticipate that the testing will wane a little bit here, but we expect it to pick up when Thanksgiving comes around and we get to more of these travel holidays. We anticipate a lot of folks to get vaccinated or will get tested prior to leaving and upon returning. So we expect a pretty robust staffing, at least through the first of the year. One thing I might add is folks that are traveling out of the country, we highly recommend that they go to Riverview or some of the other testing facilities that are more in depth and more aware of what the travel requirements are for the locations. We've had some individuals come in looking to travel, and I don't necessarily know what the requirements are to go to the UK versus India versus, say Mexico or wherever. Whereas Riverview and some of the other locations are paying much more attention to that and are making sure their paperwork matches the requirements for those travel destinations.
You mentioned travel destinations, but we just saw this week too that Live Nation is requiring a negative test result and or a vaccination card to get into any of their shows. We're seeing that, I think, the Palladium here in Carmel as well. What do people need to know? If they need to get tested, how soon do they need to get to you to get those results back in time for their shows?
So we're still running 24 to 48 hours. I guess the positive thing, if you want to look at it, is the Palladium is much smaller than Ruoff. So those concert venues, are going, or the number of concert goers going to need testing should not necessarily throw off that timing. But we do recommend, for a Saturday concert, you're in no later than Wednesday
Okay.
to get tested. That way we can ensure that you're getting your test back prior to your concert.
Mentioned Thanksgiving. It may be too early, maybe too premature, but what should we be thinking about in terms of the holiday season ahead of us?
Well, we talked about it like we talked about flu season in the past. If you're sick, obviously you need to stay home. We've been harping on that for almost 2 straight years now. The families that are vaccinated, I think you can probably plan on meeting together. If you've got minor symptoms, it's definitely gonna be a good idea to get minor symptoms being, cough, cold, something that may present like allergies or a cold. Definitely come in and get tested prior to traveling. But if your whole family is vaccinated, probably not one of those things where we're gonna say, oh, do it remotely. But everyone's gonna have to be cognizant of how they're feeling in the days and weeks after that contact. The other thing would be, skip the buffet style family setting and have one family member or 2 family members serving everybody. That way you're minimizing your touch points and not transmitting any germs or fewer germs than normally if you were to do a buffet style setting.
Okay. Anything else that we ought to consider or be thinking about in the week ahead?
Gatherings, it's that time of year where we start thinking about those gatherings. Halloween's coming up. What a great time to test your outdoor family plans and meeting outdoors. Fresh air is always the best air to be in. You know, if you're hesitant about getting vaccinated, let's, talk to our primary care provider or, that trusted individual about what we can do. You and I were also talking earlier about the 5 to 11-year-olds that we anticipate more children being vaccinated. And our plans are not fully set yet, but we are making plans so that we will be ready when that program rolls out, that we'll be immediately ready to roll in and help come up with solutions to help vaccinate those children as well. So, now's the time to start talking to your pediatricians and what's right for your family and having a discussion with your immediate family about it. Because it is definitely going to take a team to figure out what's best for your child. And, we're always here as a resource if folks need it as well.
Fantastic. Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. We'll check back in with you next week.
Thank you, ma'am.